Mental Health Nursing, 6th edition, Chapter 14, Personality Disorders. Today's lecture focuses on personality disorders. By the end of this lecture, you should be able to define personality and personality disorder, describe 3 personality disorders identified in the DSM-5, list 2 behavioral symptoms of each, identify general nursing interventions, and discuss challenges in caring for patients with borderline personality disorder. Let's begin by defining personality. Personality refers to the thoughts, feelings, and attitudes that make each individual unique. Some theorists believe personality develops very early in life and remains relatively stable. Others believe personality continues to evolve over time based on experiences and relationships. A personality disorder, however, is different. It involves maladaptive patterns of behavior that lead to significant functional impairment or distress. These behaviors are persistent and affect how a person interprets and responds to the world. Most theorists agree that personality disorders originate in early childhood, often rooted in problematic relationships with parental figures. Genetics may also play a role. It is important to note that many psychiatric patients have at least one coexisting personality disorder. There are 10 personality disorders divided into 3 clusters. Cluster A includes odd or eccentric behavior. These include paranoid, schizoid, and schizotypal personality disorders. Cluster B includes dramatic, emotional, or erratic behavior. These include borderline, antisocial, and narcissistic personality disorders. Cluster C includes fearful or anxious behavior. These include dependent, avoidant, and obsessive-compulsive personality disorders. Now let's examine 3 specific personality disorders in more detail: antisocial, borderline, and narcissistic. First, antisocial personality disorder. Antisocial personality disorder is characterized by a pattern of irresponsible, exploitative, and guiltless behavior. These individuals often fail to conform to social norms and laws. They manipulate others for personal gain and show little remorse. 2 behavioral symptoms include difficulty following rules and exploiting others without guilt. For example, a patient with antisocial personality disorder may repeatedly lie, cheat, or steal without feeling remorse. They may blame others for their actions and show no concern for consequences. There is a strong association between antisocial personality disorder and criminal behavior. Next, borderline personality disorder. Borderline personality disorder is characterized by unstable behavior and unstable relationships. These individuals often fluctuate between clinging and distancing behaviors. They may become intensely attached to someone and then suddenly withdraw or become angry. 2 behavioral symptoms include emotional instability and manipulative behavior aimed at reducing anxiety. For example, a patient may tell one nurse, "You're the only one who understands me," while telling another nurse, "You don't care about me at all." This splitting behavior creates division among staff. They may threaten self-harm if they feel abandoned. When asked which personality disorder is most associated with erratic, demanding, and manipulative behavior, the answer is borderline personality disorder. Now let's discuss narcissistic personality disorder. Narcissistic personality disorder involves an exaggerated sense of self-importance and limited empathy for others. These individuals believe they are superior and expect special treatment. 2 behavioral symptoms include grandiosity and lack of empathy. For example, a patient with narcissistic personality disorder may demand immediate attention, dismiss staff members they view as inferior, and show little concern for how their behavior affects others. Now briefly, let's review 2 additional disorders for context. Avoidant personality disorder involves extreme sensitivity to rejection and avoidance of social contact. These individuals may appear shy or socially awkward, but deeply desire relationships. Obsessive compulsive personality disorder involves preoccupation with order, control, and rules. These individuals appear rigid and perfectionistic. It is important to distinguish this from obsessive compulsive disorder, or OCD. OCD involves intrusive thoughts and compulsive rituals, while obsessive compulsive personality disorder involves a personality style centered around control and perfectionism. Schizotypal personality disorder involves odd and eccentric behaviors without the severity of schizophrenia. Individuals may be socially isolated and use unusual language or gestures that only make sense to them. Now let's discuss treatment. Personality disorders are difficult to treat. Patients are rarely hospitalized solely for the personality disorder unless there is a coexisting medical or psychiatric condition. Many individuals do not perceive that they have a problem. They may seek treatment only when their coping mechanisms fail. Medications may be used to treat associated symptoms such as depression, anxiety, or transient psychosis. Group therapy is often helpful because peer feedback can encourage behavioral change. The goal of medical and nursing treatment is to increase motivation and socialization while avoiding stereotyping or judging the patient. It is important to remember that maladaptive behaviors developed as coping mechanisms. Now, let's focus on nursing interventions. First, promote trust. Be consistent and reliable. Second, set clear and firm limits. This is especially important with borderline and antisocial personality disorders. Third, use effective therapeutic communication. Be direct, calm, and neutral. Fourth, confront inappropriate behavior when necessary. Address behaviors, not the person. Fifth, model positive behaviors such as respectful communication and healthy coping. Finally, maintain a calm and safe environment. Now let's discuss challenges in caring for a patient with borderline personality disorder. These patients may test boundaries, create conflict among staff, and engage in splitting. They may demand excessive attention or threaten self-harm when feeling abandoned. The most appropriate nursing intervention with borderline personality disorder is setting limits. Maintaining overly intense relationships is not therapeutic. Consistency among staff is crucial to prevent manipulation. For example, if one nurse allows extra privileges while another enforces rules, the patient may exploit the inconsistency. Staff communication and teamwork are essential. In summary, personality is the unique combination of thoughts and feelings that define a person. A personality disorder involves maladaptive patterns that cause distress and impairment. These disorders are grouped into odd, dramatic, and fearful clusters. Antisocial, borderline, and narcissistic personality disorders each present distinct behavioral patterns. Nursing care focuses on trust, limit setting, communication, and maintaining a safe therapeutic environment. Understanding these disorders helps nurses respond professionally rather than emotionally